Welcome to the Bangor Sports Science Podcast, the official podcast for the School of Psychology and Sports Sciences at Bangor University. My name is Amir Sandhu and I'm the host of this show, which aims to provide you with topical insights about sport and exercise science. Whether you are a practitioner, athlete, coach, student, or just generally interested in sports science, we have a selection of guests from different backgrounds who are here to share their knowledge. You can listen to this podcast on all available podcast streaming platforms and can also view the video of the podcast on our Bangor Sports Science YouTube channel. The channel link will be in the description, so please do check it out. Please also take time to like, subscribe and share our content. Wow, this is going to be nerve-wracking. Okay, 3, 2, 1, we just got to do it. We're going to jump straight in. Right, let's do it. Okay. Welcome to the Bangor Sports Science Podcast. Today's episode title is Tackling the Unseen, Non-Contact Injuries in Rugby Union. This is part of our theme about the science of rugby, and in particular we're going to explore non-contact injuries in rugby union, athlete monitoring protocols and their use in predicting future non-contact injury, and we're also going to look at concussion and subsequent non-contact injury. Now, this information is going to be relevant to coaches, practitioners, for example, strength and conditioning coaches, physiotherapists and doctors, as well as data scientists, players and community rugby union teams. Now, I'm delighted to be joined by Dr. Seren Evans today. Hi, Seren.
Hi.
Now, Seren completed a long time ago her bachelor's degree in sport health and exercise science. She then went on to recently complete her PhD, looking at surveillance to prediction, a multifactorial approach to injury risk in senior academy rugby union. She's also a final year physiotherapy student. And as if that wasn't enough, she's also a lecturer in sports science, teaching human physiology and sport injury risk, and that's in Bangor University. And she's a postdoctoral researcher for World Rugby, looking at Welsh injury surveillance in girls' youth rugby. This is an incredibly inspiring list, Seren. It's amazing. Talk us through how you got to where you are today.
Yeah, so I'm a sucker for punishment because I just can't say no to anything. So being at Bangor University, doing my bachelor's degree in sports science, then led me to a lot of kind of volunteering opportunities, and it actually stemmed from doing a sports massage course where then I got involved with the North Wales rugby team, and then it kind of snowballed then into a PhD opportunity that came up that was really fitting with what I was interested in. So I was always interested in doing more physio, sport injury type things. So then from then, completing my PhD took me about 4.5 years. Thank you, COVID. But yeah, it was a great experience. Very applied research that hopefully will have some impact within kind of rugby union as a sport. And then I've always wanted to look at similar things as what we were looking at in the men's game and the women's. So that came up with this postdoctoral research position that's funded by World Rugby. So that's super exciting that we're shortly going to get that underway as well.
Okay.
And then, the physio course has been something I've always wanted to do, and I'm finally, in my final year, I can taste the end, and it's been a wild ride, but that's kind of how I am where I am.
And what's the long-term plan then? So once you've completed the physiotherapy degree, what do you want to go into?
So long-term plan and kind of 10-year plan for me is to work within professional sport, and to be a researching practitioner essentially. So being a physiotherapist, so that hands-on treatment, rehabilitation of athletes, but also having that research element is so important for kind of evidence-based practice and making sure that we're keeping up to date. And I'm particularly interested in kind of concussion rehabilitation at the moment as well. So that's where I'd like to go. I think aim high all the time.
Oh, so, definitely. Well, certainly very inspiring. So if we move on to the main talking points of today, really, then. So we'll start with non-contact injuries in rugby union. And I think our listeners and our viewers will be particularly interested in terms of what steps players, coaches and teams can actually take to minimise the risk of non-contact injuries.
Yeah, so I think, non-contact injuries are often overlooked in rugby union, in particular with contact injuries being so prevalent. And I would be, I have to be honest, and our research, the injury surveillance study that we did showed and confirmed that yes, contact injuries are the most common injuries that happen in rugby union. And I think we went down the non-contact route because just over 20% of these injuries are non-contact. So you have about 80% that are contact related and 20% that are non-contact. And injuries have a significant impact on team success, right? So if we're able to prevent the preventable, so non-contact injuries are seen as these preventable injuries down to overuse, training load error, like loads of different factors kind of play into it to create this web of determinants of what can predict a non-contact injury. So why don't we target things that we can prevent? Obviously, there are things within contact injuries that can be done to mitigate the risks. I'm not saying that contact injuries are going to happen and they are unpreventable. But if we can make sure that more of a proportion of players are available for team selection, that has benefits for coaches. It also has benefits for practitioners, be that with medical provision and cost of injuries to players as well. And what we know about non-contact injuries is that they have quite a high rate of recurrence.
Okay.
So, if we can prevent these from happening in the first place, the cost can be reduced both to player and coach and team and, team success and stuff. So things that can be done to mitigate these risks are to monitor these athletes, obviously, but one of our main studies was looking at how pre-season training can be utilised to mitigate the risk of non-contact injuries. So we looked at how much pre-season training they were doing cumulatively, and then phases of the season. Then we looked at when these non-contact injuries would happen, and what we found was that actually, if you attained a low cumulative pre-season training load, the odds of you sustaining an in-season non-contact injury was significantly. It was 4.7, I think it was.
Okay.
So then we can't actually just look at that injury in isolation either. Because injuries happen because of multiple reasons. It's never really an X plus Y equals Z when it comes to injury, in particular non-contact ones as well. So we then looked at how previous injury can influence this, and as we added these into the modelling, that increased the odds even more to about 6.5. And then also, if they had accumulated a high season training load in the early phase, so say if they were trying to play catch up with what they'd lost in that pre-season phase, that increased the odds even more.
Right.
So I think what's important to kind of relay to practitioners is that if you have athletes that are accumulating low pre-season training loads, don't try to play catch up, because you're just going to overload them. But also we could query that because they have accumulated a low pre-season training load, they're actually doing the same as their other players in that early phase, but they're perceiving it as being a lot higher because they are not conditioned to it. So pre-season training load has a huge part to play in non-contact injuries. Okay,
and for more information, they can read the papers that you've published on this topic as well. That's great. Okay, so in terms of, I'm thinking about detection then of non-contact injuries. Are there any emerging technologies that a team could utilise to try and understand more about somebody going on to have a non-contact injury?
Yeah, definitely. We all know about how GPS is a really good measure of measuring accelerations, total distance covered. So coaches often use these to prescribe training loads to make sure that they're accumulating enough so they're ready for the game demands. But what I wanted to focus on the most was how we can create an athlete monitoring battery or a set of tests that we can do that doesn't cost an absolute fortune, that community clubs could use, that semi-pro clubs could use, because these are the grassroots, these are the foundations of the game. At the professional level, they're going to have all the the gold standard equipment. So there were some things that we used, and some tests were actually validated here at Bangor Uni, using sphygmometers to test hamstring strength. For ankle dorsiflexion angle, we just had the measure device on an iPhone and got them to do an inline lunge, and then you can measure the angle of dorsiflexion. And similar with the adductor squeeze test, we just had a sphygmometer placed in between their knees, and they would squeeze maximally, and that would give that. So there's loads of things out there that can be utilised on a grassroots, semi-professional level rugby that you can use to monitor your athletes. So it's important for them to be streamlined and obviously validated, because you don't want people spending hours and hours monitoring either. But yeah, that was the main focus really, was to make sure that you can apply it in
And
a lot of spaces.
with this technology, is the learning curve quite steep? I mean, could this be applied by, like non-specialists, or would it need somebody with some specialist knowledge?
Well, that's what's good about it. So, for example, the hamstring thermometer test was tested against the isokinetic dynamometer, which would require you to have some specialists to run that and understand and determine what the results mean. So you can definitely use it. There are protocols within the papers that have been published, and also the ones that I did on my final study of my PhD as well. And I was responsible for collecting that data, but the S&C coach would take over. The physio would also use it as an outcome measure. So there's loads of uses for them as well. That you don't have to be specialist researchers. So that's what's good.
That's good. So it's multidisciplinary, and it's the learning curve's quite easy. So this is something that even at a grassroots level, somebody could start using with their team to predict non-contact injuries. Okay, so. I suppose our listeners will also be interested in terms of the impact on a player's career about non-contact injuries and how that affects the overall team performance as well. So can you tell us your thoughts about that?
Yeah, so as I mentioned with regards to team success, if you have X amount of players out at a time, you're going to have less choice for team selection, you're going to have less choice for substitutions, which has a knock-on effect then. So say if you have a game and you don't have as many subs as you'd like, and contact injuries tend to happen because of fatigue-related things. So if you can have players available to mitigate that fatigue that players are playing 80-minute games when they shouldn't be, that is how non-contact injuries can actually indirectly impact the impact of contact injuries as well. So it's huge, and with the non-contact injuries being quite high in their occurrence as well, the cost of that, the rehabilitation time, and we can't underestimate the kind of psychological impact of that on an athlete as well. If they're constantly having to take time out because of these little niggles that are happening, it can be quite a frustrating time for them. And especially, we worked in semi-professional rugby, so that is the stepping stone that players often use to go and play professional. So if they're missing those opportunities to play, it's going to be huge for them with regards to their career. Yeah,
and then the psychological impact as well, and that has its own set of adverse impacts on performance. Okay, let's move forward then to athlete monitoring protocols then, and particularly how you might use them for predicting future non-contact injury. So firstly, it's important for the listeners to know what athlete monitoring protocols are, and in particular how they work to track the athlete's performance and health. So tell us a little bit about that.
Yeah, so athlete monitoring is there to monitor performance. It's there to it can monitor recovery from rehab if they have sustained an injury, but it's also a good indicator of where they're at currently with regards to training stress. So you can really start to tailor a really sport-specific athlete monitoring system that doesn't take hours and hours to do. So the ways in which you can utilise them is we had a musculoskeletal screening. So we'd screen the things like I mentioned, the hamstring strength, adductor squeeze, dorsiflexion angle. We also had ratings of muscle soreness. Obviously, training load is another part of your athlete monitoring. We use session RPEs multiplied by the duration, and which is a valid and reliable measure of training load. Other teams might use GPS, which is great, but the RPE is really easy to apply at various levels, and it gives you a good indication of where athletes are currently at. And finally, you'd also want to incorporate performance testing, and I think this is sometimes overlooked. Because we focus so much on the training load and the musculoskeletal screening, we don't think about actually how does their sprint performance impact their injury risk, how does their aerobic capacity influence their injury risk. So these are really important foundations as well that can all be done kind of in the pre-seasons with regards to testing. So that's what kind of formulated our athlete monitoring system, and obviously we have previous injury and awareness of what they've sustained previously. Okay,
and you mentioned session RPE, so RPE being ratings of perceived exertion, and this is characterising the intensity that particular training session might have.
Yes,
exactly. Yeah, and that's a tool that's widely available as well, isn't it? It's freely available for a practitioner or a coach to download and then use with the team at every session.
Yeah, exactly, and it can be a really good indicator if you're looking at it anecdotally. if someone is experiencing really high training load, you might start querying, okay, what's going on with this player? Do I need to adapt their training in that moment? So that's how you kind of do it at that community level. Okay, that's good. Now, I know your PhD was looking at injury prediction as well, and that was quite a core element of your research, wasn't it? So what specific metrics and data points might actually be valuable for injury prediction? So we need to look at injuries from a multifactorial perspective. And we used a pattern recognition data analysis approach to look at these. So I think that in total there was about 103 data points per player, which is huge, and we also obviously looked at their training load as well. And the things that came out as being significant predictors of non-contact ankle injury were pre-season dorsiflexion angle of less than 32 degrees. So they're also really specific as to what increases the risk of injury. So dorsiflexion angle is key. If they were slower in their 10-metre sprint and their 40-metre sprint, if they were heavier in body weight, if they had a previous ankle injury and also a previous concussion. So those together is what were the predictors of non-contact ankle injury. So if we look at that in kind of a bit more depth as to what that means altogether, if you are heavier in body weight and you are exerting high force during running through a restricted range of movement, that kind of makes sense as to ankles injuries are going to probably happen. And obviously previous ankle injury is one of the main predictors. The lateral ankle sprains recur all the time. But the interesting one within that is previous concussion. So that's kind of, I think that's where we're going next. The previous concussion one is super interesting, and there is definitely emerging evidence with regards to concussions potentially being predictors of subsequent soft tissue.
Interesting.
So
that's I'm going to ask you about that shortly then. So I wanted to just stay on the metrics, and so your model was actually quite it was quite specific, wasn't it? It was quite detailed. But do you feel that there were some things that were perhaps important but not necessarily factored into the model? So, for example, the role of nutrition, maybe even possibly genetics as well.
Yeah, I think it's really important to point out that even though we were taking this multifactorial approach, did we capture everything we possibly should have and could have? No, because like you say, nutrition will have a role. We didn't monitor any psychological elements either, and there are links with that with non-contact injuries in sport. So we took if you look at it objectively with regards to what we measured, definitely, we took that multifactorial approach, but we didn't have nutrition, we didn't have psychological components, and those could potentially be separate models that you could do. And I think, if you have the time and resources to do so, you should, these are things you should definitely tie in. We did it from a stance of we were actually trying to streamline what they were doing already. But definitely other factors do come into play. And especially if you think about injuries, the apprehension and movement after an injury is huge, but that's the psychological element that we probably should have monitored. And especially in contact sports as well, you can't be apprehensive going into tackles or movements or changing directions. So I guess we've got in terms of where the field's at the moment, there's a lot of work that's been done which has been good at characterising what's going on, but there's still more to do. There's still more questions to answer. So if we think about like coaches or even sports medicine professionals in a team, you've got this kind of data, multifactorial data. How might they make an informed decision to prevent injuries? What kind of things could they do with their team? I think it's following where the evidence is going. So say if they were to take that model that we created, and you would start to see then maybe almost like a traffic light system for these players. If players have all of these components within their pre-season and they're in the red, that they're in high risk, you could then implement some prehabilitation strategies. For example, targeting, we don't know this, but possibly just targeting one of those components could make a huge difference to the outcome. So if you target improving their ankle mobility, for example, that could have an influence. And it's important to have an understanding of the sport as well, because obviously body weight was a predictor in this sense. However, body weight can be a key performance indicator in rugby, so we're not going to start telling players that they need to lose weight to stop having non-contact injuries. It's about doing everything you can around that, if that's something that you're going to keep the same, but also you need to enhance their sprint time, so more sprint-based training, plyometric training, and all that kind of stuff. So it's about timely interventions. So these should be things and patterns that you should start to pick up in your pre-season. And that's why it's such an important phase of the season.
That's good. Okay, so now let's move on then to the concussion. So you mentioned that before, and in particular we're talking about concussion and subsequent non-contact injury, and that's quite an interesting link, isn't it? So first of all, what are the kind of potential long-term effects of concussion on an athlete's kind of long-term performance and health?
There's some evidence emerging currently with regards to the CTE, so chronic traumatic encephalopathy, and a lot of these players are coming forward, retired players that are really, there's early onset dementia, and it's really shocking and sad, but it's also a really important discussion to be having, to raise the awareness of why monitoring concussions and handling them appropriately is so important. And I think we're definitely heading in the right direction with the law changes, with the graduated return to play, but like we kind of mentioned earlier, it's about we're doing as much as we can, but we can always do more. I think you can't always come to an end conclusion where this is our graduated return to play from concussion and that's how it's going to be forever. That is going to have to change, and it's going to have to move where the research has taken us, and also taking into account these player experiences. So the long-term health is something that's being researched extensively at the moment. And also, we're looking at it from an angle even short-term. After you sustain a concussion, you are at a potentially greater risk of sustaining a subsequent soft tissue injury. There has been links in previous research about these lateral ankle sprains. And if you think about that in the context of what a concussion is, a mild traumatic brain injury, it's going to affect your balance, it's going to affect your coordination, could affect your decision-making, reaction times, all of these things that could in turn increase your injury risk from there.
Okay, interesting. Interesting and quite frightening as well, because we go back to the theme of this podcast, which is the unseen, isn't it? And you have concussion injury, you think you're better, but you've got these consequences. So in terms of so let's explore then, how does having concussion increase the risk of non-contact injuries? What's that kind of like mechanism or link?
So kind of like what I've just spoken about, really, it affects everyone differently, and that's what's tricky with concussions. Someone will have no symptoms and be absolutely fine, whereas someone else will have prolonged symptoms. And so the things that will happen is, it'll impact your vestibular system, so it'll impact your balance, and potentially the way you move, the way you run, the way you'll change direction, and all of those things. And those are key performance indicators when it comes to rugby union. And I think the pitfalls of this currently, in kind of my opinion, is we have a graduated return to play protocol that involves, light activity, make sure that symptoms aren't reproduced. Well, first off, it's some time off, and then it's light activity, and then if there's no symptoms, you move on to the next phase, which is slightly more intense. I think it's on-feet running, and then the third phase then looks at introducing them back into the sport. Now, I would, challenge practitioners to think, okay, where along that system there are we challenging these fine motor control movements, the balance, the coordination, all of these things within that? Because if you are avoiding those and waiting until they have a rugby ball back in their hand, you've probably left it too late, in my opinion, because they're going to have people running at them, they're going to have all of these challenges. And what can happen, because these things, like, can impact someone, cognitively. If you start introducing these metrics of proprioception or, these rehabilitation strategies, you could definitely aggravate their symptoms, right? But that warrants you to think, okay, well, they're definitely not ready to go back on that pitch. If they're getting symptoms, okay, they can sit on a bike and they can run, but if they're getting symptoms from doing maybe what we perceive as simple balance exercise, they are not ready to go the full way, so you need to just hold them back. And that can be quite frustrating for both practitioners, for players. They feel okay, but we need to always be safe in our practice.
Okay, so what are the rehabilitation strategies then that you could utilise to, reduce that injury risk and get them back to play ASAP?
Yeah, well, that's kind of something we're interested in looking at, and how the graduated return to play might better address these. And I know other researchers have brought these issues up as well, with how we can, best optimise that time. And also, a lot of it is to do with improving people's education on how to manage concussions, especially within kind of community and semi-professional levels, because it's different. If you sustain a concussion at the professional level, that is your full-time income. You are going to be fully supported through your return to play protocols, and you're going to be paid. You're going to be, that you have no concerns outside of that. You pull it back to these lower standards of play. You potentially don't have that support, and I think we're guilty of, in sport, looking at injuries in a very biomedical way. If there's a knee injury, we're going to treat that knee injury, okay, back you go on the pitch, and that can sometimes be the case. But when it comes to concussion, we can't take the same approach. It has to be a more, we talk about the biopsychosocial approach, how it's impacting this person psychologically. There's mood changes and these types of stuff, and socially, financially, how is this impacting them? Are they able to take time off work? And this is a whole other can of worms. But then we look at paediatric concussions, youth game. There's the diagnosis is accurate. They usually send to A&E because there's a lack of medical provision at these stages. But then do they go to school the next day, which is a very high cognitive load. So it's about educating everyone on how to best manage concussions, but it's also, as practitioners, how we can best support them through that. But I think, like I say, are we doing as much as we can? Yes, but can we do more? Absolutely.
Right, okay. In terms of the crossover then, I'm thinking of sports like American football, even football as well, perhaps boxing. Is there some crossover from what you might do in rugby science, into those sports as well? Or do you think we've got to look then at specific factors related to those sports?
Yeah, that's an interesting question. I think contact sports especially, we're going to have instances where we can do things to mitigate these contact injuries, but obviously there's some instances of foul play, accidental collisions, deliberate collisions that you can't necessarily forecast, and it is sometimes innate in sport. These injury risks are out there, but I imagine contact sports will have very similar ways of managing concussions, because you obviously need to reduce the head impacts or the high speeds collisions, not necessarily even to the head that they're doing when they're coming back. But I'm aware of some interesting concepts within football at the minute, which I imagine the management would be the same, but however, how you maybe mitigate the risks of that might be a bit different. But it's an interesting topic.
Okay, and as the other thing that I'm mindful of is a lot of the research that's been done has been in males, and that whether that crosses over to females is obviously is debatable, isn't it, because of the different physiology of females. Now, in terms of what you're doing next, you're doing your postdoc. So tell us a little bit more about how you're trying to address that kind of need in female rugby.
Yeah, we're super excited to get this project underway, and when you come to injury prevention, everything starts with surveillance. We need to know what the problem is, and in the population that we're working with in girls' youth rugby, there is very limited, if not any, data. And it's not to scare people away from playing rugby either. It's to establish, what are the potential risks and what can we do about them? We need to know what they are first. And there's been some really interesting research on female concussions as well. On Twitter, there's a great page, Pink Concussions, which discusses kind of female concussions and the research that comes out with regards to prolonged symptoms, how your menstrual cycle can actually influence the time you take to recover from a concussion, which is huge. There's loads of these concepts that have been researched now within the female game, and we're super excited to kind of support teams as well. I think that's the key part of the applied nature of the research that we do here, that we're not just dipping into these teams, taking the data and leaving. It's about that long-term effect that we can have. by implementing some preventative strategies, supporting coaches, parents as well. Even, collecting that injury data from this population. We can support parents and best direct them of where they need to go if they do have concerns. Because like I mentioned, there is hardly ever medical provision at these levels. If we can flag up, if there is an issue, we could flag this up with unions, governing bodies, and say there needs to be people at these games to cover for these players' safety.
Okay. And I think also we need to inspire the kind of next generation of scientists to look at this problem specifically in female sports, female rugby as well. And I think this is really good work that you've started, and hopefully it goes quite far and takes you quite far. Okay, well, Seren, it's been absolutely brilliant to have you here. I think I've learned a lot, many things that I didn't know before, and I'm sure that our listeners and viewers will have as well. Is there any way for people to connect with you? I mean, social media channels?
Yeah, so I've got a Twitter page for where I discuss my research, which is @LoisSeren, and then we've also got a page for our Whisker research, so the Welsh Injury Surveillance Study in Girls Youth Rugby, so that's Whisker research.
Okay, what I'll do is I'll put those links up on the video on our YouTube channel and also in the description of the podcast streaming platforms. Okay, that's brilliant. Well, Seren, thank you very much. It's been a real pleasure to have you, and we wish you all the best on your future journey.
Thank you.
Thank you for listening to today's Bangor Sports Science podcast. We hope you found it informative and enjoyable, and look forward to bringing you more episodes. Please like, share and subscribe to our content, and until next time, goodbye.